Thank you for coming. Thank you. Just before we move on, I just want any patients sitting in the audience here or members of the public, how do you think this is going?
Can we leave before you?
This gentleman who has spoken up.
Yeah.
And that lady has recognised the carer impact of caring. And he mentioned that, if the MP doesn't know what's going on,
Yeah.
the politicians,
Yeah.
influence and the clinician.
Yeah.
And then he also mentioned that carers could get paid per salary.
Yeah.
So I would be looking forward to this report. I don't like my picture to be taken.
Yeah. Okay.
I don't know where is this gentleman from. It would be nice to know where they're from.
You just search him. He's a very important gentleman. You'll find him. So.
It's polite to know where he comes from.
Thank you.
I'll give you my contact details.
Thank you.
I'll send you a signed copy of the report.
Thank you. Thank you. Thanks very much. Thank you. So, do you think this is informative? There's another lady there. Yeah. It's been useful. Thank you.
Yeah, I just want to say, they did touch a little bit about changing the culture. I think
Yeah.
the most important is changing the toxic culture and the NHS.
Yeah.
Highlighted by Sir Francis' report.
That's correct. Yes. Yes.
And because the behaviour of the staff in the NHS is
Yeah.
preventing a lot of innovation,
Okay.
a lot of care.
All right.
So I don't know how you're going to change that culture.
Well, with your help, we might. With your help, we might. Thank you very much for that. Thank you. So, our next witness is Catherine Davies. Is Catherine here?
Yes.
There we are. Thank you. Thanks for coming. I'm sure you've heard that remark about foundation trusts, so that'd be a good opening point of discussion. So thank you for being here, and I think you've got more or less the essence of what we're trying to achieve this morning.
Yeah.
You know, what are the enablers of providing high quality care in
Yes.
London specifically, and
Yeah.
what are the enablers of integration?
Yeah.
And being the not financial, I should get my right, being one of the regulators in the landscape,
Yes.
you do have a role to play. And more specifically, I hope that's in your sort of brief. We're desperately keen to find out whether the competition drivers are detrimental
Yeah.
to integration, specifically in London.
Yeah.
So, Catherine, it's all yours.
Thank you very much. I thought perhaps I'd start with a general overview about the different functions of Monitor.
We do know them, most of us.
Okay,
Yeah.
but specifically in relation to integrated care,
Yeah, okay. Yeah,
and
please,
how
yeah.
we may become involved with different
Yeah.
integrated care projects that are
Yeah.
ongoing. We have functions that relate to commissioning as well as the provision of care. So we are responsible ultimately for overseeing the procurement, patient choice and competition regulations, or the Section 75 regulations, as we call them for short. And these regulations provide a framework for good commissioning, essentially. And one of the things that commissioners need to think about is how they can improve services in their particular area through a number of different ways, including providing more integrated care. And so what we're doing there is we take cases. If someone brings a complaint, for instance, that care isn't being commissioned in an integrated way, then that could be something that we investigate under the rules. We haven't had any examples yet because it's still quite early days in the new regime, but that's something that may happen. We also provide advice and guidance in relation to procurement issues and how to procure services in a more integrated way. We offer informal advice to commissioners and providers, and we get a great number of queries about commissioning, and we get a couple of queries a month that relate to issues specifically in London, and some of those relate to integrated care. So our objective there is to make sure that people understand what the rules require them to do and how they can commission services in a way that's beneficial for patients, and to remove some of the uncertainty about whether the procurement rules prevent commissioners from commissioning services in a way that would provide integrated care to patients. Moving on to the provider side, we're responsible for enforcing licences that providers hold. At the moment, foundation trusts are licensed, but now independent sector organisations can become licensed as well, and indeed should do so. NHS trusts are also required to comply with the terms of the licence as if they were licensed in order to get themselves ready for becoming FTs. The licence prohibits providers from acting in a way that's detrimental to care being provided in an integrated way. And again, we've published guidance and we provide advice to people in relation to what that actually means in practice. The sorts of queries that we receive tend to relate to things like, does competition prevent providers from acting in a way that would enable integrated care?
That's you describing functionalities of Monitor, and we know them, and most of us know us. I really want to get out of you, what's your plans, what's Monitor's plans in relation to London?
Yeah.
And more specifically, looking at the competition rules, considering that London has its own very unique challenges. What are you doing on that side, on the competition? What's your views about what the King's Fund have said, not us, that we should abandon the competition rules until we have mature services?
Yeah. Well, I think in giving the sense of Monitor's functions, essentially what I'm trying to explain is that the provider licence requires providers to provide care and to not do things that would be detrimental to integrated care. Yeah. And we're helping facilitate that.
Oh, okay.
And so we are helping people understand that they can provide integrated care and also compete with one another, because there's a sense that the rules prevent people from doing so. If I could just move on to I think what you're asking and what touches on it most directly, there are a couple of areas. One is in relation to the policy work that we're doing at the moment. So I'm sorry, I haven't been here earlier, so I'm not sure whether you have already discussed the Integrated Care Pioneers and the national, the Integrated Care and Support Collaborative that's been set up by a number of different bodies that Monitor is involved in as well. Is this something that you're already familiar with?
Is there any in London?
Yes.
Yeah, please tell us about it,
So our role here is to ensure that people receive the advice that they need in relation to these particular projects that have been set up. So there are a number of projects that do take place in London specifically. Some of them you may have touched on already. So there are 14 integrated care pioneers, and of those there are some projects in London. They're in Islington, Greenwich, North West London, and then a fourth one in Waltham Forest, East London and the City. And I think, as far as I understand it, the general aims of these different projects is to essentially provide services that have a greater GP focus, that have more involvement of the GPs in patient care and that coordination piece that you were talking about earlier. And also to try and give people more control over their health care and to put them in a position of being able to choose what's best for them and what would work well for them. And what we're doing there is we're offering, again, advice and support. I think Monitor's role as an organisation isn't obviously we don't provide services, but it's to help people understand how the rules can facilitate the provision of integrated care and to remove barriers to integrated care and perceived barriers such as the competition rules. Okay. So with these integrated care pioneers, we're helping people understand what the rules require them to do in relation to procurement, for example, and how to safeguard patient choice in a way that would be appropriate for those particular projects.
Thank you, Catherine. Thank you. Any questions, Jeremy and then Anne? Yep.
Hi, Catherine.
Hello.
I just wanted to ask a general question about your views of the London health economy, as it's not a term I particularly like, but the landscape of health.
Yes.
So there's a number of common elements that always seem to come up again and again in discussions about London, and we've rehearsed some of them this morning. So A, general practice primary care is too small scale and too underdeveloped, and is too constrained by its premises. B, commissioning is now ridiculously fragmented and there are too many CCGs. And thirdly, there are too many hospitals and too many hospital beds. These things are often trotted out as kind of underlying problems of the structure of healthcare. Do you have any views on whether those statements are correct? And if so, what should be done about it?
So in relation to the first point that GP provision isn't working effectively, we are undertaking a piece of work at the moment where we're looking at the provision of GP services. And then we'll do further pieces of work this year in order to understand exactly what the issues are there. I think that the situation is very complex, and it's important to really understand what's happening on the ground and to understand what people want and what people actually need. So I wouldn't be too quick to jump to any particular conclusions myself. For us, it's quite important to understand the general landscape and to provide specific advice. On what was your second point again? Sorry.
Too many CCGs.
Oh, the CCGs. So again, here what we're trying to do is to work with CCGs and to work with NHS England to provide guidance around commissioning. By far the greatest number of queries we get from commissioners relates to the procurement rules, and commissioners tell us that they are anxious to try innovative solutions to provide more joined-up care, for instance, because they're not sure that the rules will allow them to do that, or because the pricing rules prevent them from putting the right incentives in place in order to make it work. So what we do there is we provide guidance to CCGs to help them understand how we see things working under the rules, and to try to help them feel confident that they can try innovative solutions and that they can try different things without fear that they'll fall foul of the rules and be challenged by organisations.
Thank you.
Can I return to, are you familiar with the King's Fund report? We had Candice Emerson here, who was
I've read the report. Yeah.
So what's your take on that? Because basically what it was saying was that the structural change that was needed in London was of such a scale and over such a short period of time that it argued for the suspension of the competition rules in order to enable not anarchy, but a structured process, but one which didn't have to meet all the tests of the competition rules. What's your response to that?
Well, I think the purpose of the competition rules is to create a healthcare system that works in the best possible interests of patients. That the competition rules generally are all about incentivising the provision of high quality care and enabling patients and their families to choose what's best for them. And also to incentivise the provision of services that represent good value for money. So I think there's a misconception perhaps that the competition rules are very rigid and they prevent commissioners from commissioning the right services for patients, and on the provider side that they prevent providers from working together in order to join up services and provide what patients want. So I see part of our role as dispelling those myths and helping people understand that the rules don't prevent those things. In fact, the rules incentivise better integrated care whenever that's what patients want, whenever that's what will work in their interests. So a lot of the issues around integrated care seem to me anyway to relate to the system being joined up, so people providing different types of services in a way that's joined up more effectively, so that discharge summaries are more effective, so that you have a coordinator of care who can help people navigate the system. And the competition rules don't prevent those things happening at all, because they're essentially all about the way in which providers of similar services interact with each other and how those options should be available to patients. So for instance, in acute care, the competition rules say that acute providers should be offering patients high quality services and letting patients choose where they want to go. And then on the commissioning side, the competition rules are really about helping commissioners to get the best possible services for the funds that they have available. And so in that sense, I don't think that those things would be preventing the delivery or the commissioning of really good integrated services for patients.
Thank you, Anne. Any questions here? No? Anything else you may wish to add? I mean, if I could take, you were here when Roy was here.
Yes.
And his idea of integrating vertically.
Yes.
How would that go down in Monitor?
Well, I think...
Is that allowed?
So he was talking about structural integration, wasn't he, where you would have a single organisation providing different levels of care. We've got some quite interesting natural experiments in that area. I was involved with reviewing the transforming community services transactions where we integrated community services providers and acute services providers. And I think it would be interesting to look and see whether that vertical integration has led to better integrated care. I know that some things have worked well and some things have worked less well. Sure. I think it's important to try and work out what we're trying to achieve and how vertical integration would actually achieve that. So often it won't be problematic, but I think it's really important to think through how it will work. I know, for instance, that within single organisations, often patients' notes are lost between different parts of a single organisation. So just structurally integrating doesn't necessarily resolve the problem,
okay.
But in some cases it may be helpful.
Okay.
So the principle of that was being proposed there, where in effect the GP would also be part of that organisation.
Mm-hmm.
You could see so Monitor would not object to that kind of entity where effectively somebody comes through the door and then refers into their own organisation.
So I think the issue there would be that it's still important to safeguard the patient's rights that are set out in the NHS Constitution and elsewhere. So if they say that patients are able to choose where they go for their acute care, that right should be safeguarded, and I think it could continue to be safeguarded if the integrated organisation is providing a good service in an integrated way that patients want. Then you'd expect patients to want to stay within the integrated institution, but I still think that they should be able to choose to go somewhere else for the acute
Sure.
portion of their care if they feel that another institution is more appropriate.
Thank you. Chairman, briefly. Yep.
You said that you spent a lot of time at Monitor explaining and giving guidance to commissioners on the competition rules and procurement rules. Does that imply that there's something overcomplicated about the rules?
I don't think that the rules are overcomplicated. They're intended to provide a useful framework for commissioning, but they are new rules. And I think that people do have questions. They want to do the right thing. The rules are principles-based, so they give quite a lot of flexibility to commissioners. And I think sometimes in the NHS, people find it easier to navigate a simple list of do's and don'ts rather than a set of principles that provide guidance. And so that's why we're trying to help people understand how those principles apply in specific situations.
Catherine, thank you very much for your time
Thank you.
for coming here, and sorry to interrupt you at the beginning.
That's
and thanks for all of that. If there are any other thoughts you may have about London, please write to us.
I will.
It would
Okay.
be greatly appreciated. Thank you.
Okay, thank you very much.